Hi guys, my name is Alyssa and I am a breastfeeding peer counselor here at WIC with the Boone County Health Department. Today I'm going to be talking a little bit about breastfeeding. So you might be wondering why you should choose to breastfeed. Breastfeeding and breast milk have a lot of really incredible benefits for both mom and for baby. For mom, right after delivery, it can actually help to reduce the risk of bleeding, and kind of more long term, it can lead to a reduced risk of multiple types of cancers, diabetes, some cardiovascular issues, and in the short term, it can also lead to a reduced risk of postpartum anxiety and postpartum depression. The benefits for baby are even bigger. Number one, breast milk is perfectly made for your baby's needs. Something that's really, really cool is that breast milk will actually change throughout the day, morning to afternoon to evening, and will change day to day as your baby grows to meet your baby's needs. It can also help reduce risk of different types of illnesses, including respiratory illnesses, tummy bugs, ear infections, and while breast milk is not this magic bullet that means your child will never ever get sick, it can lead to decreased severity and decreased time of sickness, and sometimes it can in fact keep them from getting sick at all. And it does this because it has really incredible immune boosting properties. Basically what happens is when your baby is sick, their saliva will actually be absorbed into the breast. So mom might notice there are some bumps around the nipples. Those are called Montgomery glands. And when baby is at the breast, the Montgomery glands will actually absorb that saliva. Your body will recognize those germs, and your breast milk will create antibodies to match those germs, which is really, really cool. And so if you've decided to breastfeed, when you're in the hospital, you're going to have what's called the first latch, that first time that baby is at the breast. And at this point, they are going to be getting colostrum, which is the very first milk. It's very thick, it's really yellow typically, and it is just packed full of nutrients and immune components, and is just really great for those newborn days. At first, their tummies are really small, and so they're not going to need a lot of milk, which is why the colostrum is a little bit thicker, so it can have more nutrients in a lesser amount. And so while we're talking about latch, one of my big things that I want to make sure everybody knows is that while pain can be somewhat common, I'm sure you know somebody in your life who has breastfed who told you how painful it is. That's not normal. You should not be in pain. If you are having pain, there is something going on that needs to be fixed. Although in the first few days there might be some tenderness, just because of all of the hormones that are flowing, you should not be in excruciating pain. And if you are, again, we need to fix something. Typically, there are two big main causes of a painful latch, and that is baby is shallow, they're not opening wide enough, and the second issue would be something called a tongue tie. So the first thing is latching. When baby is breastfeeding, they are breastfeeding, they're not nipple feeding. And so what that means is we want baby's mouth to be really wide open, kind of like in the photo, and they're going to actually latch behind the nipple. And so this is where, when they're sucking, this is what's getting compressed. That's where all that milk is. And so the nipple is actually kind of towards the roof of their mouth, closer to the back of their mouth. So that would be a good wide open latch. When baby doesn't open wide enough, they're more on the nipple. That's where you're getting that pain from, because they're sucking on the nipple as opposed to, nursing at the breast. A lot of times you're going to notice that when baby comes off the breast, your nipple might have changed shape a little bit. It almost looks pinched like a tube of brand new lipstick as opposed to chapstick, which is what it's more supposed to look like. It can even have some discoloration. It could look white. You might even be able to see some cracks forming. Any of those things should not be happening. And so we do want you to get some assistance and get some help if that's something that you're facing. The second common cause of a painful latch is a tongue tie. You might have heard of this. The big thing is that every single baby is going to be born with tissue connecting their tongue to the bottom of their mouth and tissue connecting their gum to their lip. Every single baby has that. So when we're talking about ties, we're not looking to see if it exists, because every baby's going to have it to some degree. We are worried about if it is stretchy enough, or if to allow the baby to move their lip and their tongue the way they need to. So oftentimes it will attach kind of back here. Sometimes it'll attach further towards the front. And that makes it really difficult for baby to move their tongue up and down or side to side. Same thing with the lip. Sometimes that tissue can make it so the baby can't kind of open their lip all the way up. And either of those things can make it challenging for baby to then latch appropriately, which then will lead to pain. So if you're having pain at all, that's something that needs to be checked out. We can, kind of chat here in office at WIC, or you can have one of your providers look at it. And we will talk more about kind of what options you have in terms of providers later on in the class. So you're breastfeeding, latch is good. Now, how do you hold the baby? There are no wrong ways to hold a baby. You can hold the baby in whatever way is comfortable for you and for baby. That being said, there are a few common positions that are kind of an easy starting point. You can do the cradle hold, which is where kind of just the very standard way to hold a baby, where you've got baby, baby's in your arm. So say baby's in your left arm, baby's nursing at your left breast. Something called cross cradle would be baby is in your right arm, but baby is at your left breast. Football hold would be right arm, right breast, but baby's feet are kind of pointing behind you. You can also lay down in a bed, both on your side, kind of belly to belly, or you can lean back, again, belly to belly, kind of like this. Like I said, though, there's no wrong way to hold a baby, and so if there's a different kind of position that you find more comfortable, go for it. So you are out of the hospital, you're home. Well, what do we expect at this point? The first few days into the first few weeks are definitely going to be the hardest, most challenging part of the breastfeeding journey. And the reason that is because babies want to eat all of the time. It's called cluster feeding, and they will want to eat and eat and eat and eat and eat. And this can happen most of the day, oftentimes, especially that second night, third night, and so on. They're going to do a lot of that overnight as well, which can be really exhausting, but it is super normal, and it's a really good sign of a really healthy baby. They are doing what they are supposed to be doing. They are filling their bellies with milk. They're also encouraging your body to make more milk. And so a lot of times you can kind of feel like, I swear I just fed this baby. How in the heck are they still hungry? And part of that is because, like I said, they've got these really small tummies when they first start, when they're first born. So when they're first born, this is about what their tummy looks like. Just teeny, teeny, tiny. Even this is maybe day 4 or 5. Still not very big. And so, they're filling it up with a feed, and then they're peeing and they're pooping, or they're sleeping, or they're crying, and they burn right through it. And so they're hungry again. And this is, again, really important because they're helping to also bring in your milk. And it takes a few days of them doing this to kind of help that milk transition from that thicker colostrum to the milk that you are more accustomed to seeing. Kind of looks more like cow's milk. Anyways, the big thing with cluster feeding is, as part of that, it's really important to feed baby when baby is hungry, and for as long as they need to, even if it does seem like they just ate. And the good news is, typically if they're cluster feeding overnight, that means that in the morning they'll sleep for a little bit longer for you, like 3 or 4 hours typically, which is a good chance for you to rest as well. In those early stages, until baby has gotten back up to their birth weight, baby does need to be eating every 2 to 3 hours overnight and during the day. Kind of once they've gotten back to their birth weight, you can really go off of when they're hungry. And like I know I mentioned feed baby when baby is hungry. And what I mean by that is, if they're awake and they're asking to eat, you don't have to wait 2 to 3 hours. You can feed them whenever. But if they're sleeping for longer than 2 to 3 hours, those first few weeks before they are back up to birth weight, that's when you do want to be waking them up. So it can be less than 2 hours, but it should not go more than 3 hours. And so I kind of mentioned on the last slide, baby eating is encouraging your body to make more milk. And the way that works is, when milk is removed from the body, it tells your body to make more. And so that's why baby is eating, because it's telling your body to make more milk. And again, that's why it's important to let them nurse whenever they want for as long as they want, especially those first few weeks, because then that really gets your milk to where it needs to be. So you're feeding baby, but they're hungry again, right? We kind of talked about that. Well, that is really normal, and you should very much expect that. I think sometimes people can worry that maybe that means that they're just not getting enough, right? They just ate. How are they hungry again? Maybe they just didn't get enough. And so kind of some other ways to make sure that baby is getting enough, to kind of put your mind at ease, is to watch for their diaper output, their hunger and fullness cues, and also paying attention to their weight loss and their weight gain. So, baby diapers, the first 5 days of life, we expect to see 1 diaper per day of life. What I mean by that is, on their first day of life, we want at least 1 wet pee diaper, at least 1 poopy diaper. On day 2, we want at least 2 wet diapers, 2 poopy diapers, up until about day 5. Beyond that, 5 to 6 diapers a day is a minimum of what we want to see. The other part of that is with the poop. So the very first poop is called meconium. It is typically thick and sticky, and it's almost tar-like. It typically has like a really dark, almost black color to it. We want to see baby pooping every single day, those first few days, as they are clearing that out of their system. After a few days, it's going to start to transition into more what we expect to see as typical breastfed baby poop. It's more yellow. It can almost look seedy. It almost looks a little bit like mustard. And that's what we want to be seeing. And so, kind of in terms of making sure baby is getting enough milk, once baby is past day 5, once baby is, in their normal breastfed baby poop, we do still want to continue to see those wet diapers. We want to see 5 to 6 wet diapers a day, at least, and that is making sure that baby is hydrated. Poop gets a little bit more, it depends on the kid. There is this really wide variation of normal with breastfed baby poop. Some babies will poop every single time they eat. Some will go a day or 2 in between poops, and that is actually really normal and okay, as long as they are transitioned out of that meconium. And so in terms of getting enough to eat. It's really the wet diapers that we look for, just making sure that they're hydrated enough. And so watching for hunger and fullness cues is really important too. Watching for hunger cues can let you know that baby is starting to get hungry, because often if baby is already crying, they're like way past hungry, and it can actually be really hard to get them to latch on if they're already really upset. And so kind of looking for those hunger cues at the beginning, they will start to put their hands to their mouth, they might start sticking their tongue out, licking their lips, they'll start to look around. Those are really good things to look for to see that they're starting to get hungry. Now, once they've eaten, these fullness cues are kind of where it's important to watch for to make sure that they're getting enough. As they're finished eating, they will often start to fall asleep, they will slow down, they'll unlatch from the breast. A lot of times baby might even push away from the breast. You can also watch their hands. A lot of times they'll start with fists, and as they're getting full and relaxed, they'll start to open their hands up, put their hands down, and just this kind of relaxed look can let you know that they've gotten enough to eat. And because of this, it's really important that when you are feeding baby, baby is unswaddled. Many parents will swaddle their babies for sleep. That is totally fine, but while they're eating, we do want their hands free. So, after diapers and watching for fullness cues, weight is going to be another really great indicator that baby is getting enough milk. So, one thing I really want to stress is that it is really normal for babies to lose weight the first few days of life. I think a lot of parents, including myself when I was the first-time mom, don't know that, and so they get really worried that baby is losing weight, and that's actually really, really typical. They are peeing out all of that amniotic fluid. If mom had IV liquids during labor, baby can retain some of that as well, and so peeing, they're peeing and pooping all of that out. That can all contribute to that weight loss those first few days. And so when that happens, don't be worried. Up to 10% weight loss is really normal, especially for breastfed babies. Over a 10% loss, there might be discussion about supplementing, but that's not something to worry about right now. Just know that it's really normal for babies to kind of lose weight. Once we get to about day 4 or 5, baby should stop losing weight and then start gaining weight again. After about day 4 or 5, we want to see baby gaining a ½ ounce to an ounce of weight per day. And so typically that means by about 2 weeks of age, which is around when baby would come to see us here at WIC, they'll be back up to about their birth weight. Beyond that, we do want to see baby continue to gain kind of on their own curve. And what I mean by that is typically you're going to hear, oh, baby is this percentile when you're at the hospital, when you're at your pediatrician appointment. And what we want to see is not a high number or a low number necessarily. We want to see baby staying with their own number. There's going to be big babies, there's going to be small babies. And so your baby being a bigger baby or a smaller baby is really not, what their percentage is isn't important. It's them staying with that number. So, we don't want to see a baby who was born at like the 85th percentile and all of a sudden is all the way down to the 45th percentile. That would be a concern. But a baby who is 10th percentile and stays, 10, 11, 12 and within their own percentage, super healthy baby who's gaining well. Okay, so I don't want you to worry about what your number is, just that they're staying within their own percentage. So I know a lot of that is really overwhelming. Newborns can be hard, but that is true no matter how you feed them, right? You are now parents. Even if this is your second or third kiddo, now you're a parent to 2 kids, now you're a parent to 3 kids. This is still a big change. You are still meeting this brand new person and trying to, bring them into your world. And baby is a brand new person, and they're trying to get used to the world. And so having a newborn is hard. So give yourself some grace. If you can let the dishes sit, let the dishes sit. If you can rest when the baby is resting, do so. And just try to, like I said, try to give yourself some grace. Kind of in that same, vein of things, it's really important to try to take some time for yourself. Take a shower if you can. Make sure you're eating snacks. Make sure you're drinking water. Make sure you're getting rest. And sometimes that can be easier said than done, of course. But those things are going to be really important for you and for baby. And snacks are one thing partner can help with. I hear a lot of the time, when can I start pumping because my partner wants to give the baby a bottle? And we will talk about pumping later in the class, but we do recommend waiting to introduce the bottle for about 4 to 6 weeks. And so, partners are often wondering, what can I do in the meantime? What can I do to help? And there is actually a lot that your partner can do to help. Diaper changes and bath time, 2 huge ones. Kind of on the last side I mentioned, making sure you're eating and drinking. Your partner can make sure he's, bringing you snacks, bringing you drinks, making sure that you're getting enough to eat. But my most favorite thing, the thing that I recommend to absolutely everybody and really, really encourage, is skin to skin. Skin to skin means partner is down to pants or shorts, their shirt is off, and baby is down to just a diaper, and they are snuggled chest to chest. And the reason for this is there's a couple different reasons for it. Number one, it's actually going to turn on a part of the brain, your partner's brain, that will help them bond with baby really well. Number two, it is going to help regulate baby's breathing. It is going to help regulate baby's body temperature. And number three, kind of going all the way back to the beginning, by baby being exposed to your partner's skin, they're going to be exposed to your partner's germs. And so then when baby breastfeeds, baby is going to be getting some immunity to partner's germs. So it's really just going to help baby be healthier, which is really incredible. And so if you guys can do like an hour a day of skin to skin, that's going to be really, really incredible for both partner and baby. And kind of beyond that, if mom has fed baby and just needs that shower, needs to step outside for a minute and get some fresh air, needs to take a nap, partner can also help, rock and snuggle and soothe the baby while mom takes a break. So, on to pumping. We really do encourage you to wait to pump those first few weeks unless there's a very specific medically indicated reason, which you will typically hear about, at the hospital. As we kind of talked about, milk is supply and demand. And so every time you remove milk, your body makes more milk. And so if you are pumping and feeding and pumping and feeding and pumping, you're going to be making enough milk, to feed, 5 different feeding times. And then you go back to work or you go back to school, and all of a sudden you're not pumping and feeding baby, you're just pumping. You're going to be making twice as much milk as you need. And that is not a great thing because it can actually lead to infection, which we will talk about later in the class. But we don't want you to be making so much milk that you are uncomfortable and at risk for infection. So waiting until you are about a week or so from going back to school or work will help your body kind of regulate that milk a little bit better. As you are getting ready to go back to school or work, you can start to pump like once a day or once every other day, just to have some milk stored up for that first day back. And so some parents do choose to pump instead of latching at the breast. And so in that case, you would be pumping every time baby needs to eat, because you would be pumping for baby to eat from a bottle. Many other parents just pump when they are back at work or school. So you are pumping when separated from baby, and you would be pumping when baby would normally eat if you were with them. And so, like I said, you're going to want to wait to do that until about a week before you're returning to school or work. And once you are back at school or work, when you are pumping, we really encourage you to pump about every 3 hours for about 15 to 20 minutes each time. Now, there are quite a few different types of pumps out there. I'm going to talk about a few of them really quickly. So this is what is typically called a Haka. That's a brand. This one is a different brand, but it's the same idea. And so this guy can actually be used while you're breastfeeding. And what you do is you kind of pull it back like this, put it up over the breast, and it creates a seal. Okay? It will actually suction to your breast. And so when baby latches onto your breast initially, there is no milk yet. What happens is baby latches, it sends a signal to your brain that sends a signal back down to your breasts with your hormones, and it lets out what's called the letdown. It's this initial kind of rush of milk. A lot of people can actually feel it. It feels almost tingly. What this is really great for is catching that initial rush of milk. Once that's done, it's best to then take it off and set it aside. You can totally save that milk and use it later. But if you leave it on, it will actually continue to pull out milk, which can lead to oversupply. But also if baby is, eating on the left side and then you move them to the right, you don't want to drain all of that milk before baby has a chance to eat it. But it can be a really great tool to kind of catch that initial milk that would otherwise be lost. A second type of pump is called a hand pump. It looks something like this. And so, once again, this piece is going to go over the breast, but you're using your hand to create that suction. Okay, and then the milk is going down into this bottle. And then the third type is an electric pump. There's a couple different types of those. And so with that, this piece is off, and there's a tube that goes in here. And that tube then goes to the electric pump, and the electric pump is what's doing the suctioning. And so once you're done pumping, you kind of unscrew this bottle. You can store in this bottle. You can also put it in a milk bag to store to use for later. And pump-wise, you should be eligible to get a free electric pump through your insurance. We have cards here at WIC that give all of the information for how you can order it. You can order it in your 3rd trimester, and they'll send it straight to your house. In addition to that, if for some reason you aren't eligible or something happens to it, if you are going back to school or work, we also do have pumps here at the office that would be available to you. And if you were to give birth and your pump isn't there yet and you need a pump, we also have rental pumps that you can use kind of until you get your own. So we've got lots of options, lots of ways, to make sure you have what you need. So I kind of mentioned, you can store in these, you can store in a milk bag. Well, then kind of what do you do with it? So milk can actually be left out at room temperature for 4 to 6 hours. It can be good in the fridge for 4 to 6 days, and then it can also be put into the freezer. Once it's in the freezer, it's good for about 6 months. Or you can put it in like a deep chest freezer for up to a year, which is really cool. And so if you've got your frozen milk and now you need to use it, you've got a couple options. If you know you're going to need it, you can actually just put it in the fridge overnight to thaw, or you can put that frozen bag or bottle of milk straight into some warm water, and that will help thaw it out. If you already have the milk thawed, You can warm that up by also placing that milk bag or milk bottle in a warm bowl, a warm bowl of water. The big thing is to never, ever, ever, ever microwave it. If you have started to defrost some milk and you realize, oh, I don't actually need it, you can refreeze it as long as there is still some milk frozen. Once it has completely thawed, it does need to be used up within about 24 hours. And we actually have magnets here in office that we can give you to take home and just put up on your fridge as a really easy, handy reminder of what all of those rules are. And so I think social media has made it to where a lot of parents think that they need to pump and store tons and tons and tons of milk, and that's not the case. So I don't want anybody to ever feel like they have to have that or there's something wrong if they don't have that. It's actually really normal and typical to just pump enough for tomorrow. So you pump Monday at work, that's what the caregiver uses Tuesday while you're gone. You pump Tuesday at work, that's what the caregiver uses Wednesday while you're gone. You pump Friday, and then because milk is good in the fridge for 4 to 6 days, you can leave it in the fridge over the weekend and use that for Monday. You can absolutely store some up if you would like to, but I don't want anybody to ever think that there's something wrong because they don't have that. Okay. Now, all of that being said, say you work in a job position that makes it really hard to pump, or you just really don't want to pump, you can also do breastfeeding and formula feeding. It really doesn't have to be all or nothing. If you would like to breastfeed when you're home and offer formula when you're at work, you can absolutely do that. And that's something, if you're wanting to do, we can definitely chat about at an appointment. So, you are pumping, you're going back to work, baby's going to need to take a bottle. Kind of when we were talking about back to what partners can do, we really encourage you to wait to introduce a bottle for about 4 to 6 weeks, much like we wait to pump. And the reason that is we want baby to get really establish your breastfeeding relationship, but also if you're not pumping, you can offer a bottle. And so the big thing is when you introduce a bottle, we really encourage you and caregivers to do something called paced bottle feeding. The reason this is, you might have heard of something called nipple confusion. Baby is not necessarily going to come to prefer a bottle nipple over the breast. What they prefer is actually the flow of the milk. Typically, when you're feeding baby, you're kind of holding baby like this, you're holding bottle like this. What happens is that with gravity, that milk is just drip, drip, drip right out of that nipple, right? Baby does not have to work for the milk at all. So then, when they're back at the breast and they're having to work for that milk, because if you remember, when baby is first latched, there's not milk there. You have to wait for that signal to go to your brain, for the hormones to release the milk. They might get frustrated when then they're at the breast, there's no milk there. And so what we encourage is paced bottle feeding. And so what you do is instead of having baby laying down, you have baby kind of sat up, more like this. And you're going to start with the bottle kind of like this. And so baby is sucking, but there's no milk there, much like at the breast. And then you're going to tilt the bottle kind of up like this. So instead of having it down with the milk just, pouring out, it's kind of like this. So that milk is still going to be in the nipple. The baby has to suck to get it out, similarly to what they're going to do at their breast. And so that just makes it easier to go back and forth between bottle and breast. And so this is just a little graphic kind of explaining what I've already explained. Okay, and since we're talking about, nipple preference, you might wonder, okay, so then how does that play into, introducing a pacifier? So pacifiers are fine. They're very much family decision, what's going to be best for you and your kiddo. we do encourage trying to maybe wait until breastfeeding is really well established, and there's two reasons for this. Number one is that using a pacifier can actually hide those hunger cues that we talked about earlier. If something is already in their mouth, you're not going to see it when their tongue starts to go. They might not put their hands to their mouth because there's something already in their mouth, and so you might miss those hunger cues, and baby will not be eating as frequently as they should be eating. And the other part of that is pacifiers use a little bit different jaw muscles than breastfeeding does, and so it can cause them to not suck appropriately when they're back at the breast. They'll usually kind of sort that out, but it might lead to some discomfort for mom. And so if you've been breastfeeding really well, there's been no pain, and all of a sudden you're having some discomfort, that could be a reason if you've introduced the pacifier. So again, there's no reason you shouldn't use a pacifier, but it's important to be aware of those two things so that you can make sure that those don't cause any issues. So nipple shields, kind of along the same line as the pacifier, they're really, really great tools. They can help in a lot of instances, but that being said, it's really important that you are only using one if you have been given guidance by a healthcare professional, because sometimes people end up using them when they don't need them, and it can actually hurt their breastfeeding relationship. And so making sure you're working with somebody who's knowledgeable about them can really make sure that you're using them appropriately and when you need to, and it can also help make sure that you can stop using it when you don't need to anymore. So I would not go out and buy one and just have one on hand. I would wait and see if it's something that you might need, and if it is, that is something that they can give you at the hospital and kind of help you use. So kind of at the beginning we had talked about that if you have an oversupply and how it can cause an infection, and infection and clogged ducts are kind of the big things to look out for. Not everybody experiences these, and there's no reason to think you might, but I always like to make people aware of them so they can be on the lookout in case they run into this challenge. The big one is clogged ducts, and that is exactly what it sounds like. Milk has, fat in it, which is great for baby's brain, but sometimes that milk can plug up your ducts. Often it'll feel like a little lump, it can be a little bit tender, and the best way to get that out is just going to be continue to feed the baby. Getting in the hot shower, massaging your breast, that can really help get them moving as well. And also what we call dangle feeding, which would be where you have baby flat on their back on a bed and you kind of stand up and over them and let gravity kind of help move those clogs out. There are two main infections that can happen when you're breastfeeding. One is called thrush, and this has nothing to do with high or low supply. This is a yeast infection actually that happens on the breast or in the mouth. On mom, it can cause red, shiny, itchy, painful nipples, and in the baby it can actually cause like white patches. It'll be all over their tongue and all over the insides of their cheeks, and it's really contagious, so it's really easily passed between mom and baby. And so if that is something that happens, it's very important to treat both mom and baby and knock out that infection at the same time. Otherwise, you can keep passing it back and forth to each other. The other infection risk is mastitis, and this is the one that would happen if you just have too much milk that you're not removing. If the milk sits there, it can cause an infection in the breast, and it can get red and swollen and painful, and it can actually give you a fever, and you almost feel like you have the flu, and that is something that also definitely needs to be treated with antibiotics. The big thing though is that no matter kind of what challenge you might run into, it's okay and important that you continue to breastfeed anyways. You don't have to stop breastfeeding just because something like this goes on. You can breastfeed through it while you're working on taking care of it. So the next thing I want to touch on are supplements. There are so many things out there that are supposed to help you increase your supply. The best way to increase your supply is to feed your baby when baby is hungry. Milk removal means you make more milk. That being said, if you really want to try that cookie, you really want to try that drink, absolutely go for it. You know, there's like the pink drink at Starbucks. I've heard of a Body Armor, blue Gatorade. I think it has to like specifically be blue Gatorade. There's all kinds of things floating around that are supposed to really help with your milk. The thing with those, while delicious, you would have to drink or eat so very much of it to make any kind of difference. And so, again, if you want that cookie because it's yummy, absolutely eat the cookie. But it's just don't expect it to make this drastic difference in how much milk you're producing. Supplements are something that I really encourage you to work with a healthcare provider, an IBCLC especially, if that's something that you're wanting to take. The big reason for that is they all have different ingredients, and different things can cause reactions in different people. And so depending on your health history, we just want to make sure you are taking something that is going to be safe for you. The big things that I would avoid, no matter who you are, is fenugreek, which is a really common supplement. And the reason that is fenugreek can actually decrease supply in some people. It can actually really upset babies' tummies in some people. And you never really know who it's going to help or hurt. And so it's better to just stay away from it. The other thing you might hear about is called domperidone. And there's a couple different kinds of prescription medications that are supposed to help with milk. Domperidone specifically is not legal in the United States. It has a really long list of really scary side effects, mostly to do with like your heart. So I would stay away from those. Like I said, if there's something that you're wanting to take, I highly encourage you to chat with like an IBCLC and find something that's really suited for you. So moving on, speaking of beer, dark beer is supposedly something that can help with your milk supply. But speaking of beer, should you pump and dump if you are going to have a drink? And that advice is kind of outdated. Milk does not build up and then store and, alcohol does not get built up and stored in milk. So it's not like you drink alcohol, it's in your milk. If you pump it, it's gone. Alcohol in the milk kind of works the same way it does in the blood, where you're going to drink, it's going to hit, its highest level, and then the longer you go, the lower the level is. And so it's, if you're choosing to drink, it's best to kind of feed baby and then drink after, and try to stick to, a drink every 2 or so hours. But the amount of alcohol that reaches the milk is not going to be something that affects your baby. The bigger concern is that you are able to take care of your baby. And so we do really encourage you to wait kind of 2 hours in between drinking, but it doesn't mean you cannot drink. Kind of in the same vein of things is smoking. It's always going to be better to breastfeed if you are somebody who smokes cigarettes. Kind of like with drinking, nurse baby first and then smoke after. If possible, we encourage you to wait 90 minutes before nursing again. However, kind of at the very beginning, we talked about babies, those first few days to few weeks, eat and eat and eat and eat. They're cluster feeding, so if that's not something that's possible, it's still going to be better for you to breastfeed. Really encourage you to smoke outside, and when you come back in from smoking, wash your hands, change your clothes, so that smoke isn't, touching baby later on. So, kind of continuing on, what about other medications. There are a lot of medications, prescription and over the counter, that are safe to use while breastfeeding. If you're worried about a prescription medication, I really encourage you to talk to your pharmacist and see, if that's something that you can take while breastfeeding. You can always call and check in with our breastfeeding peer counselors here at WIC. We have resources here. We have a book called Hale's Medications and Mother's Milk that lists every medication possible, and we can kind of check in on that for you and see if that's something that's compatible with breastfeeding. Otherwise, if you would like to look it up yourself, one of my favorite websites to do that is Infant Risk Center. It's out of Texas. You can go on their website, you can call their phone number and talk to somebody, or you can even download their app. It looks like this. It's called Mommy Meds, and what you do is you just type in that medication into the search bar, and it'll pull up the information, is it compatible, what risk there is, what kind of side effects you might look out for. So it's a really, really great option if that's something you're wanting to look at home. Otherwise, like I said, feel free to call us. And that is something I'm going to encourage you to do with any question that you have. If you have any questions, any concerns, any doubts about anything, please, please, please reach out. Google, Dr. Google, can be so very overwhelming, and it doesn't always have the right answers depending on what website you click on. Same thing with social media. Just because one thing was right for one person doesn't mean it's right for you. And as we kind of figured out with the pumping and dumping, there's a lot of information out there that's not necessarily accurate. And so if you're worried about something, it's always better to ask. So who can you ask? We are really lucky in Columbia and in Boone County to have a ton of resources. You can call us here at WIC. We have a breastfeeding peer counselor direct line that I have listed in this slide. You can reach out to the IBCLCs, the lactation consultants with university, at the phone number that I listed. You can make an appointment. They have outpatient appointments available that are free for Medicaid participants, or with a copay for people with other insurance options. They've got 3 great lactation consultants that you can see outpatient over there. You can call the Boone County IBCLCs at the phone number listed, and they're happy to chat with you. You can reach out to our Lesh League chapter, which is a bunch of moms who have started a group here, and they have some training through the Lesh League International organization. If you are in Boone County but not necessarily in Columbia, you're a little bit further out, kind of Ashland area or further, Whaley's Pharmacy in Jefferson City also has a free lactation consultant available she's incredible, and so you could also reach out to her and see her. In terms of other resources, we also have a list here, a sheet here at WIC that we can give you with a couple other people you can call, some websites you can check out, and so on. So if you ever have any questions, any concerns, again, please, please, please reach out, let us know. We are here to support you. We are here to help you. And that's about all I have to say. So thank you for hanging out with me. I hope you learned something, and I would love to see you in office. Thanks.